office because some of you have never seen a chiropractic office before. And we'll give you a little glimpse inside of what it's like to come to see a chiropractor when you're having problems with your health. So this is our reception area that we have here, and when you first come in, you'll be greeted. We'll get you sorted out with your paperwork.
I was wondering, what is sciatica?
Sciatica is back pain, lower back pain, irritation to the nerves that extends down and shoots down into the legs, one or both sides. You're in your car seat. Hopefully your car seat's all the way up, but typically the head will translate backwards when another car hits you. And a little opening, we actually can open those joints up with the pump there. And so after we've mobilized the joint or got the bone movement backwards of the neck, typically again it occurs in car accidents, but again it would depend on what's wrong. The simplicity of it, though, is that as the bones get jammed out of place in the lower back, could be this one, could be this one, it could even be a hip problem down here or a muscle that goes across. We have to free that nerve up of dysfunction. In other words, it's not working correctly. With a chiropractic adjustment, we will locate areas of the spine that are very stiff, that aren't moving correctly, or maybe jammed out of position. And the job is to get them functioning again so that they can flex, so they can move. Physical therapy doesn't address, has pain in the foot in the mornings, especially around the first toe here. So we're going to do a taping procedure to support this and allow it to heal quicker. I've already applied the top portion, and then we apply the bottom portion here. This will start to provide support and give her some relief. Spine of a brand new baby to make sure that all of its spinal segments are functioning and moving correctly. It's a scientific fact that if a spine is jammed out of place for a period of time, it will start to develop arthritis in that area. And I know it's not very common to see a baby with arthritis. I have seen kids as early as age 15 with arthritis in some certain areas of their spine. So it's basically an early handling to any spinal problems. And subluxation is a condition that occurs in the spine, and it has to do with the spine's movement, ability, and the spine's position. So a subluxation is very simply a bone that is jammed out of place that then puts pressure on a nerve or affects that nerve in some way. It also affects the nerves inside the joint space as well. And here we have 3 rooms at the clinic to serve you better. But whereas a lot of chiropractors will only use manual type manipulation, I like to have the option to do some different kinds of work with patients, mainly with the instrument called the ArthroStim. There's a demonstration on my website as well of it. But it does a light tapping motion. It's safe for your kids and also for the more geriatric type patients that can't have a lot of force or manual manipulation. We also have, in order to stimulate the muscles and help the body heal faster, the master massager treatments, which occur anytime a health problem is let go on too long. It's it continues to decay and get worse. With the spine, what can happen is that you will develop the arthritis, and that involves the disc. You're losing the disc height or having a disc problem, a bone problem with bone spurs, which really restricts motion and catches and severely restricts the way you can move your spine, your neck, and severe compressed nerves. With this compressed nerve, wherever this nerve goes, you're going to have a diseased area of the body. If it's the nerve that goes to the lungs, this person is undoubtedly going to have a lung problem of some sort. Or similarly, into the lower intestine, they're going to have a lower intestinal problem. So, to get back to your original question, don't let these things go on too long, because as they go on too long, they form permanent, sometimes unhelpable problems that me, a chiropractor, or even a surgeon.
Dr. Owens, I was wondering, what is sciatica?
Sciatica is a fancy word that describes pain in the back that extends down into the legs.
Okay.
The nervous system awareness of these joints, so the joints move freer and smoother. Every time the patient moves the joint, it's actually causing a healing action. We taped her scapular muscles here, where a lot of people have pain in between the shoulder blades. This can help support that. We did the trap muscle, his upper trap. Extend backwards over the headrest, and then slam forward. If your airbag is there, great. Sometimes the airbag doesn't go off or you don't have one. Those motions create tearing and injury. Insurance statistics will tell you that 90% of people will have pain up to 1 year after an accident. In other words, they may not feel anything for the first 8 weeks, 10 weeks, 3 months, 6 months, and then suddenly start having some mysterious. I want to show you this chart really quick. That's the hidden injury I'm talking about, by the way. So the injury occurs, and you may not. Sometimes you've heard of a sprained ankle. Let's say you've all maybe played basketball, rolled your ankle. What tears is a ligament. Well, when a ligament in the ankle tears, one of the ways we use to rehabilitate lower backs is a device called the wobble chair. And the wobble chair it's meant to bend and flex and move back and forth. One of the characteristics of discs is that to remain healthy, these are filled with water on a healthy disc. They need to flex and move. And with this movement, it brings water and helps the disc stay healthy. The water is pulled in. So, Dr. Pettibon invented the wobble chair. And proper function in life can sometimes take a while. That's a matter of getting the ligaments and muscles strengthened up around the injury site. Where's me on your side? Lower back is really important to have moving properly and in the correct position, because if it's out of place and one hip's higher than the other, your walking can cause pain in the back. You can develop hip problems, knee problems, all these things. Just generally feel where the problem is, right at L5 on Chris today. And perfect. We do a little adjustment there. Good. Yeah. Now let's go over on your stomach. Face down. So sometimes after the manual manipulation, there's more work that's needed in the spine, but I can't continue to do manual manipulations. The body just won't have it. So that's where the ArthroStem comes in. It does the same thing. It gets the bones in the right position, also gets the bones more flexible, but does it with a lighter force. So with Chris, I'm just going to go over the main areas that are having the problem, and it just does a very light tapping, which helps the bones move right into place. Good morning, everyone. Dr. Owens, Chiropractic of Bellevue. And today I want to show you a great little technique I learned and that I used myself to keep the shoulders, the shoulders pain-free, keep them mobile, and help you before your workouts, after the workouts. And all you need is a little stretchy band. And you can use any kind of stretchy band that you like. The exercise is called stretchy band dislocates. And what we're doing is we are going to work the shoulder through a range of motion where it's tight. Because we seldom move the shoulder back. We're always forward, doing computer work or working on stuff. To keep the shoulders healthy, we have to stretch them backwards, which stretches the pecs, but also work the joint capsule in the posterior or back aspect of the shoulder capsule. So that's what we're doing here. We're just mobilizing it. I suggest 10 to 15 times, and as you work that, you can feel it, and you'll start to get a little lactic acid burn. That's good. It's doing what it should do. Don't get too crazy with it. When you start out, what's nice about the stretchy band is that it'll accommodate with you a little bit. So you can start out, if you can only go to here, keep your arms locked. If you can only go to here, great. Work that motion. As you become more flexible, you can choke in on the band a little bit more. Get a little better stretch as it goes over that. I'm Dr. Owens. Use this to help your life. Hey everyone, Dr. Owens, Chiropractic of Bellevue. We've got Les on the table. I'm about to deliver an adjustment to him, but I wanted to show you something that I was reading today, and it was a good reminder. I actually came across the study, and it's about boosting your immunity through chiropractic adjustments and through chiropractic. See, in 1975, a PhD scientist named Ronald Perot, he came up with several ways of measuring how likely you are to get cancer or have a very debilitating disease. These come about through blood factors, tissue factors, and he teamed up years later. He teamed up with a chiropractor, and because he was finding that disease and the health of the spine itself are very closely related. So they did a study, and they found that the 107 people that got chiropractic care and had been receiving chiropractic care of a corrective nature, in other words, keeping the spine where it needs to be, long-term chiropractic care, made them 200% less likely to get a debilitating disease like cancer, and their immune systems were literally 200% more able than non-chiropractic patients, 400% more than people with a disease like cancer. So this tells me two things. Number one, your immune system is vitally important to your health. Number two, chiropractic care, corrective spinal care, not pain-related care. We're talking about the next level where you work on your back and body to keep it where it needs to be, helps your immune system. So I'm about to deliver an adjustment to Les here so that he can be healthy and not have cancer. Now again, these statements are not regulated by the FDA, and this is not a promise of a cure, but you've seen the data. I'm going to post it on my blog. I'll catch you later. Again, I'm Dr. Owens, Chiropractic of Bellevue. Have a great day. Some of the nerves that come out of the spine, these nerves come out and go to every single organ in your body, your heart, your lungs, your stomach, your liver, small and large intestine, sexual organs. The nerves being controlled by the brain, down from the brain, the nerves control all of your organ function. So let me ask you a quick question. Do you think if you had a bone jamming into a nerve right here causing you pain, that it could be affecting your heart? And the truth of the answer is that yes, it can. You will find sometimes someone will have a misalignment here from an accident when they were a kid. They'll have back pain back here, shoulder pain, shoulder joint pain. But also you ask them at the same time, and they've had asthma, or their lungs don't function very well, or they have shallow breathing problems. And in a lot of cases, when we fix the nerves here, we get the pressure off the nerves, the body is able to heal itself. We don't do any of the healing as chiropractors in these organs. Our job is to get the pressure off the nerve, get the normal fluid function of the spine working. The body can then heal itself. The body heals itself by turning those sick cells, those unhealthy cells, splitting up into healthy cells. And it happens over time. All right, I'm Dr. Owens, and that's how chiropractic can help the organs of the body.